So good afternoon. My name is Allison Guarino. I'm a history major by day, but I'm also pursuing a master's in public health in maternal and child health and epidemiology. My project is entitled How the IUD is Shaping the Field of Contraceptive Research and Its Use Today, a Qualitative Research Study. In 2014, the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, and the Centers for Disease Control and Prevention all came out with reports stating that long-acting reversible contraceptive methods were the primary preferred method of contraception, especially for young women. Now, you might be asking, what is a long-acting reversible contraceptive method, or LARC method? It is a form of birth control that's highly effective in preventing pregnancy. It can last up to several years, and they're really easy to use. The two types of LARC methods on the market today are intrauterine devices and the implants. However, only 7.2% of women using contraception in the United States today use LARC methods. The most common form of contraception is the pill, right here, with just about over 25% of women using contraception using that method, followed by tubal sterilization at 25.1%. So who are the 7.2% of women using long-acting reversible contraceptive methods? Primarily in the United States, they are women, young adult women, ages 25 to 34. But this is a large increase even since 2002 in the last 10 to 15 years. By race and ethnicity, they are primarily Hispanic women and non-Hispanic white women. But as you can see, we have a huge jump amongst all race and ethnic groups for use of LARC methods. So this was my study question. If LARC methods are the best form of contraception out there, why do so few women in the United States use them? And I wanted to answer this question by conducting qualitative interviews. For the purpose of this study, I'm going to focus on the LARC method, the IUD, or the intrauterine device, because it's the most common form of LARC method in the United States today. So, 7 in-depth interviews. What did that entail? 2 OBGYNs in the Boston Medical Center. Dr. Michelle Sia of Boston Medical Center is an OBGYN practicing there. She is also in charge of the residency and family planning department at Boston Medical School and is a professor. Dr. Alice Mark is currently consulting for an international women's health group, and she's doing her clinical work at Planned Parenthood. For the 5 key informant interviews that I conducted, I did them with women at the School of Public Health. I made these awesome flyers that I posted throughout the School of Public Health and the medical school buildings with certain eligibility criteria. 1, these women had to personally identify as female. 2, they had to currently have or have used an intrauterine device. And 3, they had to be enrolled in the School of Public Health. I was floored and super excited to see that within just a week of me reaching out, 43 women wanted to speak to me, and 67 women in total wanted to speak to me about their use of contraception. Now, let's hold off and understand. These are women at the School of Public Health. Maybe they're already aware of public health, maybe they're already aware of contraception and health in general, but they still wanted to reach out and speak to an undergraduate researcher about their contraceptive practices. So I'm going to share with you all the experiences and the data that I conducted. I did about 45-minute to an hour-long interviews that I've transcribed all by hand. It was an exhausting process and coded through in vivo to identify key themes. First, my healthcare providers, Dr. Sia and Dr. Mark. They shared with me that providers owe it to their patients to provide a patient-centered approach and practice shared decision-making as part of the therapeutic relationship when determining what form of contraception is best for patients. They tend to counsel towards the most effective methods first because medical recommendations say so. However, at the end of the day, patient autonomy matters. What a woman thinks she's going to use and use most effectively is paramount over maybe what is the most effective method. Also, they really argued for better education during medical school and residency programs. Family planning programs, medical school programs need to counsel and use the most effective methods out there because medical research and data shows that. There are OBGYNs in the United States that do not share the views of Dr. Sia and Dr. Mark. They don't think that young women should be using contraception in general. They also might be predisposed to the knowledge and the experiences of the 1970s and the 1980s when there were intrauterine devices on the market that were harmful and that did sterilize women. However, it's 2016. We have had the benefit of years of research and education and knowing that there are IUDs on the market that are safe and effective. But what about the 5 women I spoke to? So I'm going to highlight 3 key themes from my interviews. First, They genuinely had positive experiences. All 5 of the women I spoke to switched from one method of device to the intrauterine device, and they are all currently still using it. They stress how secure they felt for using their IUD, and in many cases actually became an advocate for its use. Study subject 1 wanted to mention to me that her IUD just does its job. It's there. Dr. Sia likes to call it the set it and forget it method. Literally, you insert it, you might want to check for the strings once a month, you want to check in with your provider once a year, but you don't have to worry about it afterwards. And that security really means a lot for young women who want to have control over their own sexual health practices. Another key point I want to bring up is community influence. Most women conducted their own research after that initial conversation with their provider. They went on Google, they went on chat forums, they went on bedsider.org. But what they really relied on were the anecdotes and the recommendation from friends and family in making their choice. I was really excited to see that 2 of the 5 women I spoke to actually found out in the process of their getting their IUD that their mothers had gotten IUDs. And for one of these women, that was paramount, that was key in her making the decision to say, hey, if it worked for mom, it can work for me. The other woman I spoke to said her mom's choice didn't really mean a lot, but it was something she wanted to share with me, and it was key to just know that this method had worked. However, the women that I spoke to did mention prejudice and judgment when getting their intrauterine device. Some women received backhanded comments or uncomfortable asides from healthcare practitioners. I want to share a story of study subject 2, who when she went to speak to her initial provider, he said he was happy to provide contraception for her, but it was interesting she was choosing to get it at this time because she was at the perfect age to have a kid. Study subject 1, mentioned that her nurse practitioner called the IUD, candidly, the abortive method of contraception, which is not what you want to hear when you're going in to get a form of contraception. It's 2016. Let's not just talk about access and cost to contraception. Let's also talk about the environment that we put women in when they're accessing these methods. In conclusion, all women interviewed in my study mentioned some level of community or family influence on their decision. A woman's built environment is key in making sure that she can not only talk to those like upper level medical professionals, but also the people around her who are going to influence her day-to-day life and can also influence her decision to receive contraception. And satisfied users can be the best advocates for like methods, and they should be valued and led into the conversation. Study subject 5 was really funny. At the end of our interview, she's like, I really want to participate in your study because I think that getting my IUD was the best decision I've made for my body's health to date. And I thought that was really cool. Finally, the last question that I asked my participants was in one word or phrase, state your current thoughts or feelings on your IUD. For these women, their IUD was convenient, comfortable, amazing, efficient, and comforting. Thank you so much. I want to give a quick shout out to Christine Sincata for making this beautiful diagram because I am not good at technology and this would have really been hard for me. To Sophie Godley, who's just an invaluable resource, a mentor, and a woman I personally aspire to be. And also all of you in KHC who have listened to me talk about contraception for the last 4 years. So I'm happy to take any questions that you might have. Yes, Hannah.
I was just curious, you were dealing with a clinician working at Planned Parenthood. Did any of your subjects say anything about kind of how there's like a stigma to accessing care through Planned Parenthood or anything like that? I mean, I know walking by it, I live right next to it, there's people protesting out there all the time. And if you're just going to get contraceptives, that can kind of be a barrier. I don't know.
No, absolutely. Only one study subject mentioned that she is actively going to Planned Parenthood right now, and she mentioned that it's uncomfortable and it's difficult, but for her actually switching to Planned Parenthood was better than the women's health center she had seen, where she actually received that uncomfortable aside, and that working with Planned Parenthood has just been amazing because of the level of professionalism and knowledge they have. Yes, Nicole.
Yeah, so most of the negative experiences that people had if they had any, were those based on stigma that they're and comments that they received from other people as opposed to the device itself?
Yeah, I do want to mention there were women who said that especially initially in the insertion, getting the IUD was rather uncomfortable for them, maybe more uncomfortable than they had thought at first. But yeah, the actual method itself was working wonderfully for these 5 women, ironically enough, but then the uncomfortable moments came from people, whether it was family members, whether it was professional staff who said uncomfortable things that didn't actually deter them from getting the method in itself, but it was something that they remembered and was like, I don't want to be hearing this right now. Yeah, Elliot.
You spent a lot of time with your project on doing qualitative research. So do you think that, especially the field of public health, needs more qualitative research, especially in a program like this?
Absolutely, because I wouldn't have my Absolutely. I mean, the fact that I can share quotes and sound bites for you from my study subjects, I think that's the bread and butter of what makes my research so interesting. Yes, I mean, there's beautiful data out there. There's really, informative elements from the quantitative research, but it's this qualitative research that really is that kind of click in your mind that, wow, this is real people and this is affecting them today. Yeah. Thank you.